I'm going to open work session on Senate Bill 2. Senator Girard, please.
Thank you, Mr. Co-Chair. Senate Bill 2 establishes the Scholars for Healthy Oregon initiatives at the Oregon Health Science University. This program will provide a scholarship to eligible participants who are entering an OHSU training program for physicians, dentists, nurses, practitioners, physician assistants, and nurse anesthetists. Participants who agree to serve in medically underserved communities are provided a conditional scholarship. These participants then must agree to serve in the defined designated area for at least 1 year longer than they participated in the training program. Failure to complete this requirement results in the repayment of the scholarship plus 25% penalty. The repayment and the penalty is reduced proportionally for each year the participant serves in the designated area or community. The Education Subcommittee approved funding of $2.5 million general fund, which is estimated to assist 21 students in the various medical fields for the 2014-15 school year. The Education Subcommittee recommends Senate Bill 2 be amended and be reported out due pass as amended.
Thank you, Senator. Discussion. Senator Steiner Hayward, then Senator Bates.
Thank you, Mr. Chair. I want to be clear that I support this bill overall, and I'll certainly be a yes on it. That being said, I want to express two concerns. The first is, while it's likely that the kinds of providers who would be needed in these areas that are specified are primary care mostly or mental health providers, I'm concerned that there's no specification in the bill for what types of specialties these people would pursue. And I'm concerned that we would be using state dollars to fund people going into specialties that don't actually meet the state's core healthcare workforce needs. I'm going to be watching this pretty closely and hope that there'll be ways to ensure that we're really getting people that we need. The second point I would make is this, and this has come up on multiple occasions in multiple committees at this point. We have kind of a hodgepodge of programs designed to improve the healthcare workforce in Oregon. This bill, House Bill 2858, which we've been considering in the Human Services Subcommittee, Senate Bill 440, which we passed out some time ago, which is the loan repayment program. It's part of the waiver, the rural tax credit, the liability subsidy, and I could go on. It's really important for the long-term healthcare workforce needs of this state that we are very thoughtful about how we use state dollars to ensure that we meet the ongoing healthcare workforce needs of the state. And there is no committee in better shape to do this than this one, where all of these bills pass through. So I would encourage each of you to work with me. I'm already getting together a group to develop a comprehensive look at this in the interim, but I expect that we'll be needing to think about this in a more systematic way going forward. Thank you, Mr. Chair.
Appreciate it. Senator Bates, please.
Thank you, Mr. Co-Chair. This is frankly a really bad bill for a very specific reason. While the bill itself outlines some of the things we should be doing to get more practitioners of various types into rural areas, the only way to access is through OHSU. I would point out to you there's at least one other medical school in the state now, and hundreds of medical schools across the country with similar programs preparing people for rural practices or for underserved areas. To allow one medical school, one institution to have this and nobody else is a bad policy and a bad start. We need to sit down between now and February and put together a holistic approach to putting people into rural areas. The things that Senator Steiner Hayward just mentioned, med malpractice, premium relief, a way of doing a tax credit, a better way of doing loan repayments, but it should not be limited to one. I'm looking forward to the day when two physicians are sitting out in rural Oregon, one getting their premiums paid or their scholarship for paying back this huge loan they've got, and the other one sitting there with his partner saying, I'm not getting that because I didn't graduate from the right medical school. And that can easily happen. You're going to block out a lot of people coming in. It's the wrong policy, sets the wrong precedent. I'm a no and will stay a no. We need to sit down, defeat this bill, come back in February with a better approach to this entire problem. I've argued against this all the way through the session. I was surprised it came out of the Education Committee. I'm shocked that we're talking about it here today. And frankly, I'm very disappointed that it's gotten this far along the line without someone standing up and saying, this is the wrong thing to do. If you want to do something on OHSU, just write them a check and get it over with. This is about politics, not about policy. It's the wrong thing to do. I'm totally opposed. I hope others will join me in voting no on this bill and bring it back in February, open to everybody, not just OHSU graduates. That said, I'm a big supporter of OHSU. I work with them almost weekly with patients. They're a great organization. I'm not shooting at them for this. This is simply bad policy and a bad bill. I hope you vote against it with me. Thank you.
Thank you, Senator. I have Representative Nathan, Representative Smith, Senator Hensel, and Representative Richardson. Representative Nathan.
Thank you, Mr. Chair. I don't want to take up too much time because we have many bills to go. I'll just say I want to emphasize that I concur with the remarks of Senators Steiner Hayward and Bates. I'm concerned about several things. One is, the primary one is not looking at the various ideas for loan forgiveness, loan repayment, other sorts of assistance, which healthcare occupations we're trying to encourage, and in what parts of the state. We're not looking at these comprehensively as a package. We had different bills going to different subcommittees, accomplishing different things. I think there should have been a way of bringing those together for a better review. When dollars are limited, it's important to figure out how to spend the dollars in the wisest way, and maybe you can't do everything at once, so you pick the most important things to do first. So I will concur with the remarks that have been already made.
Thank you, Representative. Representative Smith, please.
Thank you, Mr. Co-Chair. I guess to offer a contrary thought on this, it is so difficult in rural Oregon to attract high-quality, professional medical providers. And I'm not sure this is the perfect answer, but I can share with you those communities such as John Day and Heppner and Caker City and Burns. It's difficult to attract a quality professional healthcare provider to those communities, and I think this is going to turn out to be a very valuable tool in attracting those high-quality professionals. I would hope in the future that we'd continue to evaluate this and to open it up even further, as the good Senator Bates has shared. But I can tell you, we have a lot of rural communities that desperately need this investment, and so I really appreciate you stepping up, the two of you stepping up and bringing this forward.
Thank you, Representative. Senator Hensel, please.
Thank you, Mr. Co-Chair. I'm going to be supportive of Senate Bill 2. We're hearing over and over again in District 29, which I share with Representative Smith and Jensen, that healthcare providers are just unable to make their loan payments because the revenue that they have, they'd like to serve there, but they have such an indebtedness that they're not able to stay very long, if at all, because of the nature of the revenue that comes in. I think Senate Bill 2 helps address that. I'm also would be a strong supporter of Senator Bates' efforts to expand that in the short session, but I don't think we should not move this one forward while we wait for a more perfect or a more comprehensive. I think this is a good start, and I'll be a yes vote for Senate Bill 2.
Thank you, Senator. Representative Richardson, please.
Thank you, Mr. Co-Chair, and I just wanted to say I support my good friend Senator Bates in his position, and I'll be voting against this because I think that to pick winners and losers and say that Oregon's rural physicians or physician's assistants or others that medical practitioners that are so needed can only come from one school to get this benefit, when in Oregon we have 2 schools. We also have students that can't get into school here because it is such a restricted admission process. I mean, there's only so many physician assistants that can attend OHSU. And if you want to be a physician's assistant, then you have to go elsewhere. I have a daughter who's actually finishing her 2nd year in University of Utah, and she had interviewed in New York City because she couldn't get into one in Oregon and wanted very much to be a physician assistant, and so she was going to go wherever she had to. She's coming back to Oregon. Not that she needs to have this program because we've been able to work that out, but it's the point that if you're an Oregonian and you want to work in Oregon, in this area, in a rural environment, why should you have to graduate from one university in order to get the benefit? This kind of winners and losers makes no sense to me.
Thank you, Representative. Representative Williamson, please.
Thank you, Mr. Chair. I appreciate this conversation about looking at the needs of rural Oregon and our healthcare needs in underserved populations in the metro area as well. There's two things that I think that I like about this bill, and I would hope go to the larger conversation about meeting rural needs. And the first is that the entire amount of the funding for this bill goes to students, so nothing goes to administration. I think that's a really important piece to this conversation, and that first preferences will be given to students from the regional universities. We know that if you recruit out of rural Oregon, then providers will go back to rural Oregon, and so I think those are two pieces of this conversation that aren't lost, and I hope is if we move forward to look at a larger conversation about encouraging providers to move into rural Oregon, that's part of the conversation, and that we continue those two policies.
Thank you, Representative. I have Senator Edwards and Senator Hayward. Senator Edwards, please.
Thank you. Having served on the subcommittee from the Education Subcommittee from where this bill came, I know that there was a lot of discussion about our other medical university, and I certainly supported that effort, but we have a relating clause problem with this bill when amendments were attempted to be prepared, because this bill relates to specifically to OHSU, and so so we have I didn't know if there were other bills in the works to take care of it, or if we were looking at this as there's a finite amount of money to spend on this. And so for this session, it was going to be this, and then maybe next session, our other university, our other medical school. So I will be voting yes, because I think half a loaf is better than the full loaf. But I absolutely support including all medical schools in Oregon in this program, and hope that we can get it done in February or next session. I don't know what the plan is, but it's a good bill.
Thank you, Senator. Senator Hayward.
Thank you, Mr. Co-Chair, and I apologize for speaking twice, but I thought I might take a moment just to clarify a couple of things. I agree. We should be doing everything to support those who are choosing health professions and plan to serve in the specialties we need, in the areas where we need them, in all sorts of ways. And I want to point out that the loan forgiveness program that we passed, which is a $4 million bill, is applicable to anybody who graduates from any healthcare institution in state or out of state, and certainly people coming back to Oregon would be more than welcome, regardless of where they got their training. The second piece is that with any luck we will find the funding for House Bill 2858, which is a continuation of the loan forgiveness program established in 2011, and that is applicable and available to students at any health profession program in the state, assuming that they have a well-established rural track and planned rural track, and that's what they're pursuing. And we heard testimony in the hearing on that in the Human Services Subcommittee that the Office of Rural Health, which administers that program, is working closely with the other medical school in the state to ensure that one of their programs meets that, and students there are eligible for this loan forgiveness program. This really cycles back to exactly what I said in my very first comment. We have a lot of programs, we're trying to approach things in a lot of different ways, and we need to get comprehensive and be thoughtful and coordinated, but I don't want to let the perfect become the enemy of the good. We need this program, we need to make the debt load manageable, and I urge your support for this, and I commit to working with everybody who's interested to develop a much more comprehensive approach that includes as many people as possible.
Thank you, Senator. Further discussion? Senator Monroe, please, and Senator Winters.
Thank you. This bill came through our committee, and those of us that care about the rural areas of our state and having health access in those rural areas support it. You'll notice not only does this affect only students that are at OHSU because of the relating clause. OHSU is one of the finest teaching hospitals, not in the United States, but in the world. It's been rated as one of the top 6 in the world. So students get a fantastic medical education at OHSU. And then we structured this so that preference goes to those students that come from the what we call the regionals, Southern Oregon, Eastern Oregon, Western Oregon, the regional universities. So that's a preference. We know that if students come from the more rural parts of the state and get their education, their medical education, and then go back to their home in more rural parts of the state, they're more likely to stay there and provide the health access necessary. This is a good bill. It doesn't accomplish everything. There is another piece of legislation, I don't know exactly whether it's going to make it or not, that would allow access to the smaller institution in Lebanon. I support that and will continue to support it. But for now, this is a good bill. We should be all voting for it.
Thank you, Senator. Senator Winters, please.
Thank you, Mr. Co-Chair. First of all, I need to state that I care about the rural areas, and I care about, the access to medical care, and some of us have been working for years to try to talk about finding a solution for enough docs and nurses and practitioners. And as one who started her career at the University of Oregon Medical School a lot of years ago, don't comment. And so I really value OSHU in a lot of ways, not only as one who kind of grew up there, but also who had her granddaughter who had 2 major brain surgeries there. But having said that, I'm going to join my Senate doc, Bates, because I do think we need to get serious, and as the good Senator Steinberg Haywood said, and become a lot more comprehensive in addressing this need. One of the things that all of us have talked about in one fashion or other, whether it's health care or some of our other things that we are involved with, is that we can't continue to silo these needs that we have in the state. And so for those reasons, I will be joining my good doc, Senator Bates.
Thank you, Senator. Further discussion? Seeing none, I think, Mr. Rocco, I'm going to call for a roll call vote on this one, please.
Senator Winters?
No.
Senator Bates?
No.
Senator Whitsitt?
Aye.
Senator Monroe?
Aye.
Senator Girard?
Aye.
Senator Edwards?
Yes.
Senator Thompson?
Aye.
Senator Steiner Haber?
Aye.
Senator Hansel?
Aye.
Vice Chair Johnson?
Aye.
Co-Chair Devlin?
Aye.
Representative Smith?
Aye.
Representative Jensen?
Aye.
Representative Comp?
Aye.
Representative Hannah?
Aye.
Representative Freeman?
Aye.
Representative Barker?
Aye.
Representative Huffman?
Aye.
Representative Reed?
Aye.
Representative Frederick?
Aye.
Representative Williamson?
Aye.
Vice Chair Richardson?
No.
Vice Chair Nathanson?
No.
Co-Chair Buckley?
Aye.
Motion carries.
Close work session. Thank you,